from cellulite? I'm sure a lot of us do. An expert is here to tell you about a new laser treatment that could help you with that problem. But while he's doing that, we have someone else who's going to come and talk to you today, Dr. Ginsburg, here to tell us about the first and only long-lasting cellulite treatment that has just been approved for use in the U.S.
Welcome back to Talk of Alabama. When's the last time you wore short shorts? Well, or maybe just shorts in general, right? That's what we thought. Well, no matter what your age, don't let cellulite keep you from showing off your legs. At least that's what Dr. Barry Ginsburg says. He's here today to talk to us about a new treatment, well, new to us at least, right, Doctor?
Yes, yeah. The Cellulaze has been used in Europe for about 2 years. Yeah. But we've been, I bet you Cleopatra tried to treat her Cellulaze.
I was just going to ask you, when did it first start?
Yeah, I mean, women have always been trying to treat cellulite.
Yeah.
Cellulite. You know, years ago there were creams containing caffeines, and then we had non-invasive massages, and I mean literally everything. But nothing up until now has changed the structure.
Are we looking at cellulite right here?
Yeah. Well, yeah, you're looking at the fat lobules in the skin, and the things that are going up and down are the fibers septi. And what causes cellulite is bulges in the fat and pulling down by fiber septi and thinning of the skin.
So I always had thought you can't get rid of cellulite, but that's not the case. You're saying you can.
This treatment goes into the cellulite and treatment. This is not an external treatment. This is performed in a very similar manner to triplex laser liposuction.
So is this a before and then after?
Exactly. Exactly. And the results are at least 6 to 12 months. Probably there are follow-ups 2 years in Europe which show persistent results.
Okay, that was a picture of somebody's hiney. What am I looking at here?
Probably upper thigh.
Upper thigh, okay.
Upper thigh is the most common place to see cellulite. Upper and lateral thigh, backside, lateral backside.
So is this called Cellulaze? Is that what?
That's the name of the device made by Cynosure.
And is there any pain involved in this?
It's local anesthesia. It's performed in a very similar manner to laser liposuction surgery.
So how would it work? If I have cellulite and I want to come in, you would say, okay, we're going to use the general anesthetic, and then
not general anesthetic, local anesthetic. Local anesthetic.
What's the difference between the general and local?
One is an injection, and the other is putting you to sleep. You're not put to sleep.
You're not put to sleep.
Not put to sleep.
And then how long does it take?
You come in the office and we circle the hills and the valleys.
Okay.
The hills is where the skin is raised, the valleys is where the skin is depressed. You have both in cellulite.
Oh, okay.
So we circle the hills and the valleys, we inject the local anesthetic, which takes about an hour.
Okay.
Then I come in with the laser, and the laser addresses the 3 factors of cellulite. They address the bulges by melting the fat with a certain, that's the technology, is the wavelength of the laser. It melts the fat in the raised areas.
Okay.
It cuts the fiber septi. It goes under the skin and cuts the bands that are pulling the skin down, and then it thickens the skin.
And then how many treatments? Just one?
One treatment.
Okay, one treatment, and then you should see results after that. And then can you go out and do your normal stuff? I mean,
yeah, there's no recovery.
If you go running or exercise, you can do all your normal activities.
We usually have you wear a compression garment after, just like you would after liposuction, but you can still function. You can go back to work. You can do your normal activities. You wear, it's sort of like a tight pair of biking shorts or Spanx or something like that you wear after the procedure.
Interesting. And so, as you said, it's been in Europe for a couple of years. It's fairly new here to America as far as people doing it. You offer it at your practice. How's it been going so far?
Well, right now it's going to be offered in about a month. This was just approved by the FDA 2 weeks ago. Yeah. It's been in this country the studies have been going on for probably a couple of years. But I'll be the first one in the Southeast to offer it. And
are we looking at a huge expense?
Depends on the size of the area done, probably between $2,500 and $5,000. But it's a lifelong treatment, and I don't think there's a woman who has cellulite that doesn't want to get rid of it.
That's right. We all have cellulite.
It's 80% of women have cellulite.
Dr. Barry Ginsburg, thank you so much for your time. We certainly appreciate it. It's called Cellulaze, and Dr. Ginsburg is the only one here.
And we're going to be having a seminar tonight.
Okay.
So everybody's invited.
Where?
At my office, 972 Montclair Road, 592-4880.
Thank you, Doctor. We've got to take a quick break, but still to come, we've got to show you a hidden treasure.